Joining me now is Kari Odermann, media observer, to talk to us, joining us live from Kiev, to talk to us further about the COVID-19 situation in Ukraine and Ukrainian president contracting the virus. Good afternoon, Kari. Thanks for joining the program.
Thank you and good morning from Kiev.
Now, please tell us about the current situation there in Ukraine with regard to COVID-19. What's the latest updates you can give us?
Let's start with President Zelensky's situation. Just before 9 a.m. this morning, it was made public that he has been relocated to Fiofana Hospital. This hospital is ran by the Ukrainian government, and it's for top officials, diplomats, and high-ranking military officials. What's interesting is absolutely no information has been given about his vital statistics. So all we know is that he's chosen to go there to isolate. This hospital is located in the southwest corner of the city, and he'll be comfortable there in his one-bed room. Now, you listed off quite a few names already of people, prominent politicians that have contacted COVID-19, and the list is getting longer and longer each day. As you mentioned, he had first tested positive on Monday, and now just 4 days later, he's been admitted to the hospital. Things aren't looking good here.
No. Has he made an address to the nation at all? Have we heard from him?
He has a very interesting relationship with the media, and he has given a press release out. That's what I was talking about. It came out 9 a.m., a little bit before 9 a.m. local time. He has said that he's chosen to isolate to keep other people safe. However, if you look at his schedule in the past 2 weeks, he was with several G7 ambassadors in the conflict zone on November 6th. I know that many of these ambassadors are now also self-isolating because they're primary contacts. His chief of administration, Andriy Yermak, who you also mentioned on October 31st, was in a meeting with several G7 ambassadors. And in the photos available on Twitter, he's the only person not wearing a mask.
Interesting. Okay. Now, what about the situation overall in the Ukraine? A lot of the European countries are now entering a second phase of COVID-19, and it appears that it's a lot more vicious in some of those countries than what it has been way back in March. What's it like in the Ukraine? Do you have lockdowns on the horizon? Are there a lot of restrictions there?
There's theory and there's practice here in Ukraine. Our health minister, a man named Maxim Stepanov, has said already a month ago that the situation here is very tense. In September, half of the beds were occupied. Now, there aren't that many intensive care COVID beds available. There has been growing numbers. We're nearly at 10,000 cases a day. We were in a lockdown in March, April, and almost until May, which was very strictly enforced. Over the summer, people were putting their heads in the sand, and they're choosing what they consider economic issues over the health of the country. The health minister, although he does have a medical background, is a politician. He's the former governor of Odessa, and this is about his political career, a lot of people are saying. He has said that people should do what's right for themselves and make choices. But we've seen that in other countries, too, also in the United States, when governors have insisted that people make decisions that are responsible for themselves. It hasn't always worked out. They've said that, and backtracked quite a bit, that there were certain milestones. If they were met, there would be a lockdown. But then President Zelensky or other members of the administration backpedal and say they won't do a lockdown. Now, this weekend we'll be experiencing the first weekend lockdown. That means hospitals, pharmacies, veterinary pharmacies, and some restaurants with delivery will be allowed to be open. But other than that, the cities should be shut down.
And how long do you think these restrictions will go for? Any idea there?
Surprisingly, this first try is just for this weekend. Okay. They're asking people to wear masks, but if you go out on the streets, I live in central Kiev, you'll see that people aren't wearing them outside, and it's hard to enforce them in some stores. And of course, the question is, how do you properly wear a mask? If you just wear this mask pro forma and have it along, it's not actually meeting the needs for COVID prevention.
No. Okay, Kari, thank you very much for joining the program. It's lovely talking to you, and stay in good health.
Thank you.